This is the second part of papillary carcinoma thyroid, where we are going to deal with the necessary investigations. So, when the patient presents to us with the neck swelling, the first thing to start with will be a plain ultrasonography of the neck, which is done with the radiologist. So, when we do an ultrasound of the neck, we can find out that the normal report or the findings will be the thyroid gland is enlarged, and maybe there are 1 or 2 nodules, and we look for at least 7 to 9 points in the ultrasound, which may be suggestive of that this particular nodule which is seen in the ultrasound can be cancer or malignancy or carcinoma. So the first thing is ultrasound neck, and the same doctor, when they suspect that this can be a case of malignancy, they'll put in a small needle, take out the cells and send it for histopathological examination, which is called as fine needle aspiration cytology, which hardly takes 5 minutes, and the reporting is done within 2 or 3 days, within 48 hours approximately. And with the report, this topic being papillary thyroid carcinoma, the report is going to be the same. That's what we are discussing. So what are the other tests? Now we have already come to a diagnosis. Now we have to prepare the patient for treatment. So treatment is surgery, followed by, if there is any thyroid tissue left behind, we had to find out how much. So second will be radio iodine scintigraphy. And the third one, if there is thyroid tissue which has been confirmed by iodine scintigraphy, we would like to do an ablation, burn out whatever thyroid is left behind in the neck. So the next water preparations is for, we have to prepare the patient. So now we have to do the blood test. That is, we do a routine which includes CBC, complete blood count, then liver function test, renal function test, electrolytes, blood sugar, creatinine, and all which is necessary to see whether the patient is fit to be taken to the OT. And for sure ECG and chest X-ray also. These are the general investigations. Along with that, we would like to do 2 more things. That is thyroid function test, T3, T4, TSH, which is usually normal, but we need it. And one more thing, serum thyroglobulin. Why the serum thyroglobulin is important? This is going to help us for follow-up after surgery. When the patient is on regular follow-up, this value is going to help us. We need a baseline workup. And when we do serum thyroglobulin, we like to do serum thyroglobulin antibodies also. These are the investigations which is usually done. Now, when we have planned for surgery, for surgical mapping, if the thyroid is huge and we feel there is extension, and especially the retrosternal has gone low down the neck, we like to do imaging like CT scan or MRI. So if you ask me, CT scan or MRI, which do I prefer? I will say MRI, though it is costly. The reason I will tell you, because CT scan is done with contrast, and the contrast being iodine, which contains iodine, and anything which contains iodine, it later interferes with the treatment and further investigations for the same case. So I would like to do a MRI scan where we get the extent of the disease, and we can have a surgical mapping depending upon the imaging. The other investigations which I have told you already, I have mentioned serum thyroglobulin and antibodies I have already mentioned, and chest X-ray to see whether there is any related chest problem or is there any secondaries or not, and ultrasound abdomen to see if there is any secondaries or not, the liver, everything, whether everything is fine, along with the liver function test, and the electrolytes also I have mentioned, along with vitamin D. These are the general investigations. So now we have come to a diagnosis that this patient has been labeled as papillary thyroid carcinoma. So please do watch the third part, where I will detail about the surgery first. And the fourth part is going to be about iodine scintigraphy and iodine radioablation. The last final part, the part 5, will deal with recurrence and how we are going to investigate the recurrence and how we are going to manage the recurrence. Thank you so much.